Discovery Health have produced some groundbreaking analysis on the latest effects of the Omicron variant. They have completed research on the effectiveness of current vaccines and that those vaccines have against this variant, including its effect on children. So much information coming out. Let's go to the person who is able to crunch it all together and make sense of it all. eNCA's Heidi Giokos, and she joins us now for an update. So, Heidi, let's start here. What did the research say on the impact of the current vaccines against the Omicron variant?
So it's not all bad news to us, but definitely some effectiveness that has been lost due to the Omicron variant. Of course, it's important to highlight the fact that Discovery Health has been able to collate this data, especially from its members, and has been able to provide some kind of insight into exactly what is going on with Omicron, how transmissible it is, how severe it is, and how these vaccines actually work against Omicron. The most important information, because of how important vaccination is and how important of a tool it is in fighting this pandemic, Discovery Health has found that the effectiveness of the double Pfizer shot, they have done analysis on Pfizer, which is a vaccine that's being administered here in South Africa, has reduced from 80% in the Delta wave, which is the previous wave that we saw here in South Africa, the third wave, to 33% in Omicron against infection and reinfection. We've heard how highly transmissible this is. We've heard how even if you have been infected by previous waves, you are possibly likely to get sick again or reinfected. So that's reduced to 33% in terms of reinfection. And when it comes to severe COVID-19 and hospitalization, which is, of course, what we're all looking out for, how serious is this variant? What is happening in our hospitals? Are people in need of oxygen and ventilators? We understand that the effectiveness has reduced from 93% in Delta wave to 70% in Omicron against severe complications, which is hospitalization. So there is some effectiveness against severe COVID-19. It's at 70% with Omicron variant and 2 Pfizer shots. That's why there is a discussion around booster shots and how this is going to kick in as of the 28th of December for those 60 and above who got their second Pfizer shot 6 months ago. So there is some good news coming out of this, but of course there has been a drop in effectiveness. But let's listen to Discovery Health on this.
In terms of the vaccine effectiveness of the double dose of the Pfizer-BioNTech regime, the vaccine effectiveness has reduced from 80% in the Delta wave to 33% now in this Omicron wave against COVID-19 infection, quite a material reduction. But the vaccines were developed to prevent severe illness and death. And what is very encouraging is that the vaccine effectiveness of this double dose of Pfizer-BioNTech holds at 70% in the Omicron wave against severe complications of COVID-19, which we measure by hospital admissions. So 70% vaccine effectiveness in mitigation of hospital admissions.
Discovery's Ryan Noach there, Discovery Health's Ryan Noach, giving that update a bit earlier on. Heidi, there's a lot of information, misinformation, disinformation, rumors, and anecdotes shared all over the place. In the last few weeks, part of that has focused on the impact of the Omicron variant on children. Different experiences, not always, we can't always dismiss them as not being credible, but certainly some based on anecdotal experiences. Discovery has been able to talk to what they are observing about the impact of Omicron on children. What are they telling us?
Yes, so it's important to note the fact that there is some anecdotal information coming out, but also clinical information that has been brought to the attention of Discovery. What's interesting here, Tulas, is that many people are hospitalized for surgery or for any other kind of reason, and as per procedure, they are tested for COVID-19, and people are found to be positive with COVID-19. So this is also why they're finding that many people might be hospitalized, but it's not necessarily because of COVID-19, it's because of other reasons, and they just find that they would rather be observed for a few more days because they did test positive for COVID-19. We did hear from the NICD, especially when Omicron was first identified, that those under the age of 5 were being hospitalized, but it was very mild and it was more just out of caution. What's interesting here is that in terms of what Discovery Health has found is that there is a 29% average lower admission risk relative to previous waves. And children to date have had a 20% higher risk of admissions. But we've been warned, even by the Department of Health, by the NICD, and now with Discovery Health coming out with this information, that we should not panic. And it's just important for us to understand why children are being hospitalized this time around. Previously, we saw 60 and above being hospitalized. Now we're seeing those under the age of 19, even under the age of 5 being hospitalized. So yes, it has a lot to do with people not being vaccinated, but it's nothing too severe. And we do know that majority of the people who are being hospitalized, 70% of them are not vaccinated. So that has a huge role to play, but still nothing to be too alarmed about. And of course, they are monitoring the situation. But yes, there is a worrying trend that the younger population is being hospitalized, and it's especially under the age of 19 and under the age of 5. Let's listen to Ryan Noach, Discovery Health CEO, once again.
Children during this wave, as reported by the National Institute of Communicable Diseases here in South Africa, seem to be at 20% greater risk of hospitalization during the wave. It's important, though, that I say they are experiencing very low test positivity rates relative to adults. And in absolute terms, the admission of children to hospital remains very low. And so there is no reason to panic in this regard, without question.
All right, Heidi Giokos, I've got to thank you. Heidi reporting on all the angles of the Omicron variant. All right, Heidi Giokos there.
Yes, Omicron, you got it right. You got it right.
I've got it, Omicron. Thank you. In case you're just joining us, of course, you don't know, you don't have the backstory. I was making fun of Heidi earlier on. Not making fun of her, just appreciating the way that she pronounces the name of this variant, it being Greek named, she being of Greek heritage. She says it better than all of us, really. We anglicize everything. What is with people who speak English and assuming that everything is in English? It's not in English. It's Omicron. Omicron, okay? Thank you.